how long is this going to last? And he said to me, it lasted as long as it lasts, and that's all you need to know. So I felt like, you know, he didn't want me to have an idea that in 10 years this is going. Because sometimes in your head you will, you know, at that 10-year mark, you're going to start thinking, oh, that doesn't feel right. Is this, you know, is this time for it to go? All right, the recovery period we know is lengthy. And you, what did you say, average recovery period?
I look at it in stages. For a couple of days, you hurt a lot. It usually takes about 3 days before you're comfortable enough to go home to be able to get in and out of bed by yourself, in and out of a chair by yourself. But by the time you leave the hospital, you're putting full weight down. It'll usually then take somewhere between a week and 3 weeks to get most of your motion back. The knee tends to be very stiff after you've operated on it, so at first it doesn't want to move fully. Once you get your motion back, then you can get your strength back. And so usually by 6 weeks, most people are walking fairly well. Most people are no longer needing a cane. Those people are not normal. They've still got a long way to go in terms of their strength. And then if you look again at 3 months, most people at 3 months would tell you they're essentially doing everything they want to do.
How many degrees of bend is what you're shooting for?
You need 90 degrees of flexion or bend to get out of a chair. And it used to be in the old knees that we were very happy to get to 100 degrees. Now most of them are going to get to at least 115, and a lot of them get to 125. So because of the newer models, newer meaning in the last 20 years, patients will get a lot more flexion, and most people can expect to get at least 115, and a lot of them get 125.
How important is physical therapy after knee replacement?
It's probably more important than your surgeon. It takes a lot of work to get that knee back moving, and it isn't the most comfortable thing. And a good therapist is really very important in terms of helping that patient through that, kind of coaching them, kind of pushing them. It takes a whole lot of talent on the therapist's part to really work through that. So they're very, very important.
I mean, you really have to be dedicated to taking responsibility for your own rehab. You cannot go in there and expect the therapist to do it for you.
Exactly, and you've got to be willing to do your exercises in between therapy sessions and really work hard. It's not going to, just replacing the knee is not going to make you better. It takes a lot of work.
All right, I know that there's bicycles, you do rehab on bicycles, but you sent me to have water therapy.
Yes.
And that was one of the most enjoyable things about my therapy, because it got me out of a building, it got me doing something that was very different, and I felt like it helped so much because of you're pushing against the water and you don't realize that you're doing that until you get out, and then you have a sore knee. But right. I thought that was one of the most helpful things. How satisfied are the majority of patients who have this?
If you look at the big studies, around 90% of people are very happy with their knee. Another 5 are happy, but they're not perfect, and 5% are not that happy. So you got about a 95% success rate, which for any surgical procedure is very good.
Yeah, that's good. How important is weight control? I mean, I know that we see patients who are extremely obese who come in and don't sometimes do as well because of the weight they're carrying.
Yeah, and I think obesity is really a double-edged sword. If you've got a patient who's obese and has a bad knee, that person is not going to be able to exercise enough to really get into shape for a knee replacement, and really is going to have a hard time afterward getting going.
Right.
If their knee is bad enough, if you don't replace them, they're never going to have a chance to get it going. So it is a double-edged sword. They do have a higher risk of infection, superficial infection, so you have to balance those risks and tell those patients. But ideally, we would all replace fit, thin people, and,
right.
and they certainly would do very well.
Right. I know that there's a minimal amount of blood loss during the procedure, but do you still have patients donate some of their own blood ahead of time?
We do. If you're going to need blood, it's much safer to use your own. So what we like to do is have the patient donate his or her own blood, and then if we need it, we use it. It's not that frequent that we need it, but it's hard to predict sometime who will and who won't need it.
All right. We have about 2 minutes left. Time goes by very fast when we're doing these shows. If somebody's interested in finding out about joint knee replacement, is there a website that they can go to?
The best website is our Academy website, the American Academy of Orthopedic Surgeons, and it's aaos.org. They're not promoting any particular product, but they have good information about knee replacement, decision to do a knee replacement, post-operative regimes. It's a very good website.
And we're both aware of a cat that recently had the first total knee replacement. We saw it in the paper.
Right.
All right. I thank you so much for
Thank
coming.
you.
And I hope that something you've said has answered questions for people who may be in the process of knowing that they're going to have this kind of surgery.
Hopefully.
Really appreciate it.
It's my pleasure.
Hope you've enjoyed tonight's show and that it has answered some of the questions you may have about knee replacement. Chris and Paula McNutt, who were a part of a helping mission in Guatemala earlier this year, are going to be my guest on the next show. Please stay tuned, watch the show. Thank you so much for watching. I hope you have a wonderful evening. Good night.